According to a WHO report, a woman is diagnosed with breast cancer every 4 minutes. In fact, breast cancer is now the most common cancer among Indian women. Despite these numbers, awareness and early detection remain worryingly low. That leads to late diagnosis in more than half the cases. Hi, I'm Preeti, and today on this podcast, we are going to talk about everything every girl and a woman should know about breast cancer. And to lead us through this conversation is Dr. Poovamma C U. Doctor, welcome to the podcast.
Thank you.
Thank you so much for giving us time today. Doctor, I want to begin by saying that when it comes to breast health, let's say that there is no question which can be labeled as silly or basic. Is that correct?
True.
And when you are approached, let's say, by a young girl in her early 20s who wants to know more about breast cancer, how would you begin explaining her?
So I think that's the most important thing is education. Like how you said, the cancers are so common and yet diagnosis is so late. The truth is that for every 2 women diagnosed with breast cancer, 1 die in India. Okay, 1 dies because it's diagnosed late, and that's because of lack of awareness, maybe not accepting diagnosis, delay in diagnosis, procrastination. It could be anything, or they're just busy with careers, families. So what is important is to know yourself, your body, to recognize how your body is, how your body feels like, how the breast looks like, feels like. So always we tell women, please examine yourself. It's going to take you a minute or 2, but it could lead to an early diagnosis, okay? So having said that, not every lump in the breast is a cancer, especially in younger women. There are a lot of other non-cancerous lumps. So just because you picked up something in the breast, it does not mean it's a cancer, because of which you get frightened.
Right.
But what we say is every lump in the breast should be evaluated and cancer should be ruled out. So examine yourself, look at yourself once a month. After your period is over, that's when your breast is the softest. It feels soft and, not very knotty or nodular. And if you feel anything different, any kind of a lump, a thickening, which is persisting, and breast cancers are very silent, okay? They don't cause pain, right? So that's the reason women come late to us, because they say, even educated women will tell me, I noticed something, doctor, and it's that women are very perceptive. They have noticed something wrong, but there's a delay from the time they have noticed it to the time they come to us, because they assume it's not malignant or it can't be a cancer. So I think the first thing we need to get across is everything has to be evaluated. The sooner we pick it up, the better it is for you.
So there is this confusion which arises because in your answer you mentioned that not every lump is cancerous. However, you must come for examination. So a lot of women, I know, they relate it to lumps in other body parts. And they say that, I had developed something on my wrist, it went away on its own. Something on my, leg had come, it went away on its own. This will also go away. So what is that absolute moment when it comes to breast cancer or a lump in your breast that you should get it detected by a doctor, rush to the doctor and not delay? What is that moment?
So I would say any lump which is persisting beyond 1 menstrual cycle for women who are premenopause, okay? And for anybody who's post-menopause, any new lump identified has to be evaluated.
Immediately?
The sooner the better.
Okay. And a lot of people are apprehensive about biopsy, because once you detect a lump in your breast, the first advice that comes is get a biopsy done, and that will determine whether it's cancerous or not. There are so many theories circulating on social media that say that, once you prick the lump, cancer spreads. Would you like to say something about that?
So I think there's a lot of myth related to breast cancer and, the diagnostics tools that we use. And one of them is this biopsy that, many people ask me when I say, let's do a biopsy, you're probing the tumor, will it not spread? In breast cancer, that's not true. There are certain areas in the body where we don't put in a needle, okay, where we know doing a biopsy can worsen the situation, but breast cancer is not one of that. So for breast cancer, a biopsy is a must. A biopsy is a must, because without a biopsy report, we will not start treatment.
Right.
Okay. So even like there's a myth that, mammograms cause cancer. I shouldn't undergo mammograms. There's exposure to radiation associated with mammograms, or, because I've done a mammogram, I can't get cancer. Okay. So mammogram is just another diagnostic tool where you get it's just an imaging of the breast to see or look, to see for any small tumors or to assess any lump in the breast to see what does it look like on imaging.
Right.
So any lump in the breast is always, evaluated. We call it as triple assessment. We look at it clinically, we look at it radiologically, and we also do a tissue diagnosis.
So let's talk about this, importance which is given to early detection. How does early detection really help? And in your experience, at what stage do women in India usually turn up for detection?
So in India, a lot of our cancers are stage 3 and stage 4.
And that's bad.
And that's bad, yes,
Yeah.
that's bad. And that's why our mortality rates are on the higher side compared to the West, because detection is late. Okay. So a stage 1 breast cancer has a cure rate of 96 to 97%. Okay. And a stage 2, 90%. Whereas a stage 3, it comes down to 80 to 85%. Whereas a stage 4 breast cancer is not curable. Okay, so we can then treat, we can, prolong life by certain number of years, maybe depending on how well they respond to treatment, but it's not curable. And that's the difference.
Even for a young girl, it's not curable? A stage 4?
It depends on the stage. Yes. It's not respective to age.
Okay.
So the stage is how big is the tumor, has it gone to the lymph nodes in the nearby areas, has it spread beyond the breast and the lymph nodal basin. So the stage is what is important. And also in breast cancer, we do certain other tests to see what kind of molecular subtype of tumor is it. Is it a hormone positive tumor, a HER2 new negative, or triple negative variant? So those also tell us how it's going to be prognostically.
Doctor, it's a very scary area for a woman to navigate, especially if someone in your family has been diagnosed with breast cancer. It can be your own mother or your aunt or someone. So if it is there in that profile, is it absolutely essential that every girl in the family should get a mammography done or some sort of testing done? What should that be?
So that's another myth that, breast cancer only occurs in patients who have a family history of tumor. And that's something very commonly we hear when we have a diagnosis of breast cancer. People tell us, I don't have a family history, so how did I get? 90 to 95% of breast cancers are not genetic, meaning to say they're not hereditary.
90 to 95%?
Yes.
Oh my God.
So it's only 5 to 10% of breast cancers which are hereditary. Okay. So routinely we do those tests today. We look at the individual's DNA. It's a simple blood test which can evaluate and tell us whether there's a abnormality in the gene which is making it a hereditary type of a breast cancer. Okay. So though hereditary breast cancers are very small percentage, the way they are treated and the way they are followed up or evaluated is slightly different, because the chances of that individual's progeny having breast cancer increases. So say X, it could be the father or the mother who has, say, this abnormal gene. So every child of theirs have a 50% chance of having inherited this abnormal gene. So if they have inherited, then they're at an increased risk of developing not just breast but also ovarian cancers and certain other tumors. So for them, the way we look at that and how we do screening mammograms is very different from somebody who doesn't have a family history.
And at what age should these girls approach you? For example, if a 60-plus lady in the family has been detected with breast cancer, she would have her daughter, perhaps her granddaughter also who's in teenage.
So for all women, we say today in India above 40, please do a mammogram once a year or once in 2 years.
Okay.
And then again, this difference whether it's 40 or 50, because the Western countries they say above 50.
Okay.
But Indian breast cancers occur a decade earlier. Okay, so we have younger women. So that's why we say after 40. Below 40, any symptom or anything the lady identifies, we say picks up, we say please get it evaluated. Coming to hereditary breast cancers, then we only if their gene proved that they have an abnormal DNA, they're carrying this abnormal DNA, then we start them at 10 years or at the age of 25 or 10 years younger than the youngest person in the family has had cancer.
That's very early.
Yes.
Can that be intimidating for a very young girl?
It could be very, very intimidating. And it's not only for the individual, but even for the parents.
Absolutely.
It is the prospect that, the children are so young. How do I break this news to them? So we don't advise these genetic testings till the children are at least crossing 18. It's not advised. Okay. So only after they're 18, then we counsel them, we counsel the family, we talk to them. Do they want to do it now or they don't want to do it now? They just want to keep them, be screened more often. So we screen them at 6 monthly intervals than a year interval. Okay, so it's always a conversation between the family, what they want, how they wanted to go about doing it.
So, doctor, you mentioned something very interesting, and that is that Indian women have 10 years less as compared to, some other countries where 50 plus is the usual time when diagnosis happen. Why does it happen with Indian women at that age? Why do we have this 10-year gap less in comparison to others?
The real reason for that is really unknown. Okay, so we just have this from the data that's available to us from the cancer registries, that Indian women are a decade younger at diagnosis. So nearly 40 to 50% of breast cancer in India occur in women less than 50 years of age. Okay, so that's one of the reasons we keep talking about this, because a lot of young women keep assuming that it can't be cancer only because of age, right? So I'm young, it can't be tumor. But nearly 4% of breast cancer women are in their 20s, 16% in their 30s, 24% in their 40s. So if you look at that, nearly about a half a chunk of the women are less than 50.
Yes.
So that's why we keep talking about that, because we don't want women to think that this can't be cancer. You can take it for granted. And many a times we are falsely reassured sometimes by our own family, right? Family, friends. I mean, those are the people you talk to. It can't be. It's just your menstrual cycles. It can't be anything else. Like I had this girl, she was, I think 33, 34, had this lump, kept telling her mom, I feel something. And then she said, mom says, no, I'm sure it's just your cycles. 2 months later, I still feel something. Becoming bigger, then finally comes to us, and then she was at stage 3 at that time. I mean, at 34. And then we went probed back. She had a family history. Her father's side, grandparent had a breast cancer. So it was genetic. So that's why maybe also one of the reasons when she had it at a much younger age. But even otherwise, without any family history, we do see a lot of women in their 30s.
Okay, so doctor, talking about assumptions, there are also a lot of assumptions floating around new mothers. Because, once you stop feeding your child, a lot of new mothers or young mothers, they experience lumps. And, traditionally in a family, the elderly women would say that, oh, you've just stopped breastfeeding. So these could be those nodes of, the milk in the breasts and stuff like that. At that time, what is the right approach if you are detecting some lumps in your breast?
Breast cancer is the second most common cancer that can occur during pregnancy.
During pregnancy
itself, okay? Second most common. It's unusual. So we say 1 in every 3,000 pregnancies can have a breast cancer. And that incidence is not just during pregnancy, but it's also 1 year post-pregnancy, the lactation period. So as the age at which women are having their first child is increasing, okay? So that itself is a risk factor for breast cancer. So when women above 30 have children, they're already predisposed, slightly higher risk to develop breast cancers. So any lump detected during pregnancy or lactation, like I said, doesn't have to be a cancer, but has to be evaluated. Okay.
Don't sit over it.
So I've had a lot of women who come in like that, who've had tumors picked up during pregnancy, the first month, second month of lactation. They just told it's a milk lump. It's a milk lump, so it's okay. But, they come to us at least 5-6 months later than when they could have.
And that's already lost time.
Yeah, that's lost time. So something from a stage 2 has become a stage 3. It would have progressed, right? So a lot of the things during pregnancy obviously are not cancer. It will be just milk lumps, the breast feeling big, lumpy because of milk. But any kind of a lump that has to have felt has to be evaluated.
And I'm still going to stick with the topic of assumption because, at the cost of these assumptions, we lose crucial time. And sometimes we end up giving an advice which is not supposed to be given. So a lot of young girls these days are told that if you're wearing a tight bra or you're always wearing tight clothes, that is increasing your risk of developing breast cancer. What is this connection?
Okay, that's a complete myth, okay? So breast cancer is a lifestyle disorder, meaning to say it is because of the lifestyles that we lead. It could be what you're eating, what you're drinking, the water you're exposed to. How old are you when you had your period? Or, did your periods end late? Did you have children late? Didn't have children at all, okay? Or obesity, lack of physical activity, smoking, alcohol. All of these can cause breast cancer, but not the garments you wear, okay? So there's really no correlation between maybe dark underclothes, underwired clothes, tight clothes, deodorants, perspirants. No, none of them have been implicated for breast cancer.
Okay. And what about things like, your activity levels? A lot of young women or women from their, let's say, 30 to 50s who are actively going to gym, monitoring their protein levels, their nutrition levels, because their awareness is quite good around these things. They seem to believe that we will not develop breast cancer. How are all these things connected to obesity, your fitness levels, your activity levels, your diet? What role does that play?
So, being fit, being physically active, keeping your weight under check, eating good nutritious food, all of that go a long way. Keeping your stress down, sleeping accurately, correctly, getting adequate sleep go a long way in preventing cancers. Okay, that's something that is known. But having said that, you could, still maybe eating well or exercising, but you could still be stressed out. You could still be not sleeping well. So just because you're eating well or, exercising, that doesn't mean you can't get cancer. But it might decrease your chances of developing a cancer.
But you can't rule it out.
No, you can't rule it out. No.
But then how do we call it a lifestyle issue?
So it is a lifestyle, but like I said, lifestyle is multifactorial. It's not just about exercise. You could exercise 1 hour and then sit on for the whole day.
Yeah.
Right? So that's bad. So sitting is considered equivalent to smoking, right? So it's not just about 1 hour in the morning I exercise and then the whole day I have other unhealthy practices. I sit, I'm not exposed to sunlight, I don't move about during the day, I eat unhealthy, I don't sleep well, I'm highly stressed out. So all of that can still lead to cancers.
Right. And what about those again, ideas circulating on social media that if you eat flax seeds, they are good, you will never develop breast cancer, or some sort of food habits. Do they play any part?
So I think food plays a big role, okay? So what you eat definitely plays a big role, but you cannot take it one point at that particular time. It's about eating healthy in general. It's about, trying to, have a colorful plate, have more veggies, have more fruits, more fresh foods, seasonal stuff, eating your seeds. All of that is helpful. I'm not saying it's not helpful. And it might go a long way in helping prevention of cancers, but there's still the other things that you're exposed to. You're exposed to maybe, the food additives, the preservatives, the food colorants, the kind of oil you use, the contamination or the pesticides you're exposed to. So it's
even the air we breathe.
Yeah, the air we breathe also it's polluted, right? So there is definitely a lot of things that we can do to reduce our risk. But having said that, I cannot say, if you do all of this, I give you a guarantee you're not going to have cancer.
Doctor, I want to now talk about a very important facet here, and that's self-checks and screening. A lot of women, including me, we don't know what is the most appropriate way to examine our own breasts. And we need you to, give us a step-by-step guide really on how to do this at home and how often should this be done.
So self-breast awareness, we call it as breast awareness, okay, is very important, I think, because you know your body. So what we advise is once a month, okay? Ideally, once your period is over, so you say your period starts today, that's considered day 1. So ideally, say day 7 to day 10. When your period is over, that's when the breast is at its softest, okay? So you typically stand in front of the mirror, put your hands up, look at yourself, see for any obvious, asymmetries, or meaning they don't look the same. The breast, is it looking one bigger, one smaller? How do the nipples look? Do they look flattened? Do they look pulled inwards? Do you see any kind of an obvious lump in the breast? You look at yourself first. After that, you lie down. And you put one hand up, and with the opposite hand, the opposite breast. If this is the breast, you use the flat surface of your fingers and gently press downwards. Start from the nipple and gently press downwards in either you go in a circular motion or you go radially, okay? And just gently feel yourself, okay? Don't hold the breast like this, people come to us, they've held the breast like this between fingers, and normal breast will feel like a lump and they get scared, okay? So gently, push your fingers down with pressure and feel. So you learn how your breast feels like, okay? So doing that at a regular basis can help you to identify smaller changes in the breast.
And at what age should this start?
Ideally, no age. I would say above 30 at least.
But younger than that,
Even them, there's no harm in being aware of your own body, right? So maybe even 20, you could start it.
and what's the right age to start with your mammograms and clinical, screenings?
So typically in India, we say above 40, you go for a mammogram at least once a year or once in 2 years. Okay. But for women less than 40, we say even if you could do a sonomammogram, 30 to 40, I started telling people just go for a ultrasound of the breast. Okay. So we don't do a mammogram for younger women because they tend to have very lot of breast tissue, because of which mammograms are not accurate in picking up tumors. So less than 40, we say start with ultrasound of the breast, and then if required, we will do a mammo. But above 40, it will be an X-ray mammo and an ultrasound of the breast.
As far as mammogram is concerned, there are a lot of ideas circulating around it, especially for those women who feel shy, they feel awkward, they have some sort of fear that this is going to be painful. What advice would you give to them? What sort of breast exam should they go for? And is mammogram painful?
Some women do complain that mammogram is painful because in a mammogram, the breast is squeezed between two plates, okay?
Two screens.
It's two glass plates and the breast is compressed, and then the radiation goes through, X-rays go through to take an image, okay? So I would say it's uncomfortable, okay? And the duration for which it lasts is few seconds to less than a minute.
Will it last after the examination?
No, usually not. So I would say it's once a year. You're uncomfortable for maybe a few seconds to a minute or two. But if that could identify a cancer even before you could feel it, and or say a stage 1 cancer is detected, when you look at the pros and cons, the benefits from doing it outweigh the risks or the pain, I would say.
A few seconds of pain can rule away an entire year perhaps of treatment.
Yes.
Right. I think that's a very important point. But what about those who find it embarrassing and awkward?
So this is usually done on one-to-one basis with one technician there, and usually there'll be a lady technician. So that there's a screen there, so it's not that, they're asked to strip down in front of so many people. There is a lot of amount of sensitivity to the test. There's usually one person, they give them the time to change and keep them covered most of the time. So I think it's not that very.
And this fear of exposing yourself to radiation unnecessarily, quote unquote?
I think the amount of radiation that we're exposed to in our everyday lives is a lot more than what we are exposed to with one mammogram.
So it's worth it.
Yeah, it's worth it. Yeah.
Right. So, doctor, let's talk about now the treatment part. Once diagnosis has happened and, we begin the treatment, when someone, a woman comes to you with a suspected lump, step by step, what are the first few tests which are recommended, and how does a doctor really approach this sort of a situation?
So we always start with the clinical breast examination. So every single patient is examined by us, is examined by the doctor.
And should they straight away go to an oncologist or a gynecologist, especially a woman who has detected it?
So ideally, it's the oncologist, but many a times they go to the gynecologist because they've had a long relationship with them. They've met them for certain other things, but whoever. Ultimately, it will come to us, to the oncologist, okay? So the first thing we always do is a clinical breast examination, followed, then we look at what the clinical science is telling us. We always do a mammogram and an ultrasound of the breast. Again, correlate clinical findings with mammogram and ultrasound findings. And if it's suspicious, then we do a biopsy. Okay. So that is usually called a co-biopsy, where we give in local anesthesia, put in a needle, take pieces from that lump. It's an office procedure. It's a OPD procedure. It hardly takes 10 minutes.
Will be done under
It's
anesthesia?
a needle. Yeah, it's a local anesthesia.
Right. Okay.
Yeah, it's local anesthesia. So you're walking in and you're walking out. But only thing is the reports will come in 2-3 days. And once
biopsy is done on the same day that you get admitted, and then you can go back the same day?
Yes. It will take maybe 5-10 minutes to do the biopsy.
I think that's very important for you to explain to the listeners here, because the very term biopsy triggers a bit of a fear that, will I be admitted in the hospital for a while?
No.
What is it going to be like?
No. Ideally, they'll go to the radiologist, get their scans done, and then come back. So either we will do a blind biopsy or an ultrasound guided biopsy. So the procedure per se will hardly take less than 30 minutes. Okay. So local anesthesia is given. So the patient is wide awake. Only local anesthesia, Then we get a special needle for that. We introduce that needle into the lump, and via the needle, we take small pieces of the tissue and send it to the lab for testing.
Okay.
So that's a biopsy. So the biopsy usually will give us an accurate report. Is it a cancer? Is it not? If it's not, what else could it be? Then if it's a cancer, then we do additional testing on that to see what kind of subtype of breast cancer it is. And then we go on to do other staging tests to see whether cancer is restricted to the breast, underarm, has it spread beyond to other organs. So we do tests like PET-CT scans. And once we have the biopsy reports, the subtype report, and then the PET-CT report, we would chalk out a treatment plan for them.
Okay, I'm going to talk about both the scenarios separately, but first let's talk about a scenario where a woman came to you with a lump, and that lump turned out to be non-cancerous. Can she forget about it?
Yes, usually when we have an accurate diagnosis, we can safely tell them that there's nothing to worry and send them home.
Would you usually give an advice about radiation or other processes which are going to be taken care of? Or she can be like, a free-minded person now that, okay, this is nothing to worry
there's
about.
no cancer, there's no requirement for radiation. Okay, it'll all depend on the diagnosis, how big is the lump, what did we find out. So as long as it is a non-cancer, say a fibroadenoma or some fibrocystic disease, or there are a lot of other things that can happen and it's completely non-cancer, we might just ask them to come back and see us after a year for it. Okay. But if there is, say, stage 0 breast cancer, or there's cancer, or there's something called as atypical ductal hyperplasia. So an ADH or atypical ductal is just like one step prior to cancer. Okay. So if there is a lump in that, then we might say, okay, let's just remove it.
Okay, this is new for me because I thought that cancer stages start from stage 1. But there's a stage 0.
Stage 0, yes, that's called DCIS. Okay. So that's duct carcinoma in situ, where the cancer has not come out of the cell. So that's stage 0 with a 100% cure rate.
And that gets detected in PET scan or even?
No, not PET scans. It's usually either clinical or on biopsy, it tells us it is stage 0. Yes, that is, there's only stage 0.
That is a very, very interesting thing to know because a lot of people don't know about the stage 0 of cancer. Now, let's talk about the detection that has led to the discovery that this is a cancerous lump and it has to be treated. Let's talk about the treatment options. What are the treatment options available today? Because they say that, the positive side of so much of detection of breast cancer and increase in number of cases is that we have treatment today and we have advanced treatment. What are those options for a patient?
So as long as the cancer is curable, that is stage 1, stage 2, stage 3, the treatment is usually multidisciplinary. Okay, so we have a surgical component to that. We might have chemotherapy, we might have radiation therapy, and we might have newer treatments like hormone therapy, targeted therapy, immunotherapy. Okay, so are we going to start with surgery or are we going to start with chemo will depend on the kind of tumor, the stage of the tumor,
and the age of the patient.
That again will be depending on say somebody is above 70 and then they have very small tumors which are hormone positive, then we directly go for surgery. If they have a triple negative variant of a breast cancer or a HER2 new positive variant of breast cancer, or the cancer has spread from the breast to the underarm lymph nodes, okay, then we would start with chemotherapy. So there are a lot of different ways we plan the treatment, and that's why many a times we tell patients, please don't go home and discuss with your distant relative, friend, somebody else's Masi had something, and then they come and tell me, they had only surgery, somebody else had only chemotherapy, or somebody else had only tablets. Why is there so much of variation? So we have to personalize the treatment to that individual. What kind of tumor do they have? At what stage are they? How old are they? So we have to take multiple things into consideration before we come to a treatment plan. So for that, please talk to your doctor. They will be able to tell you what's required for you and how we have to plan the treatment for that individual.
So basically what you're saying is like every individual is different, every cancer, every lump is different, and every protocol is designed specifically for that person and the lump that
so there are broad guidelines which we follow. So most of the patients would fall into 3 to 4 categories.
Okay.
Yes, it's not that every person's treatment is different, but there are 3 to 4 categories that they would fall into.
So, doctor, like you said that, once somebody is going through that process, that a cancerous tumor has been detected, they will definitely go back home and speak about it. They will talk amongst themselves, look at the options that are available on the table in terms of the specialists and how others dealt with it. There are also home remedies, Ayurvedic remedies that people fall back on. How successful those alternative cures are.
When it comes to cancer, and I think breast cancer, I always, I think this is something we often get asked, okay? Tell my patients, please complete your allopathic treatment, and then you want to try any home remedy, anything else, please try it. But that will not be the first line of treatment, okay? Because we have seen enough patients who have defaulted from us, meaning got diagnosed, then went back and then tried all these alternate types of therapies and then come back with advanced stages. Okay, there are some small percentage who are very happy with these, because in breast cancer also there's one variety which can be very slow growing. Okay, so then they feel these treatments are working for them, but they definitely come back. They come back. So please complete your allopathic treatment. We can still give you, like I told you, cure rates, and then you could try any kind of home remedy. But I think definitely the home remedies, or your good food, good diet, good healthy eating will help it to prevent a relapse.
Okay, so let's now move to another very important topic, and that is life during treatment and after treatment. How does this affect a person's life who's undergoing the treatment? Because we've seen those horrific images of a person going through chemotherapy, losing all her hair, the entire glow on the face. They have weight loss, massive weight loss, the zeal to work, even get up from the bed. The diet goes for a toss. There are a lot of side effects as well. What is life like for a person undergoing treatment?
The most important thing, I think, is to continue with normal life, not to make dramatic changes.
But is it possible to
It is definitely possible. It's not that it's not possible. Yes, chemotherapy is difficult. It definitely has its side effects. And I think every individual responds differently. The amount of side effects again vary. There are some people other than the cosmetic side effects, they're completely hale and hearty. They don't have anything else. But there are some who really struggle with chemotherapy. They have nausea, they have that vomiting sensation, they have that, bitter taste.
Also, diet is very common during chemotherapy.
Or because they have a little bitter taste, right? Because of which they don't feel like eating. Then some feel very tired, lethargic. Having said that, I have had patients who have gone trekking during chemotherapy, really? Youngsters, yes.
Yeah.
And some who tell me that, everything has been completely okay. So the entire spectrum we see, from people who've just had the cosmetic side effects to the people who, every cycle is difficult. Every cycle they have loose motions, they don't feel well, they feel tired. So very difficult to generalize and say it will be like this. Everybody responds differently. But what we can tell is that this is temporary. All of this is going to go back to normal once you finish. You have to give it a little time, but you will be back to normal. And I think knowing that is important. There is light at the end of the tunnel.
Absolutely. And that sort of hope is something that you doctors are giving to a lot of patients who've shown the courage to come forward, report their lumps or, the issues with them and get the treatment plan. But when we talk about, you should have a normal life. In a normal life, if somebody was highly active, wouldn't it be advised to them to take it slow? Rest is equally important. How do they balance it? Some jobs are also very rigorous. Can they continue to do it?
So I think what you pointed out is very true. So every time I tell my patients, please take it one day at a time. I do not know how you will be during the first cycle or the second cycle or the third cycle. Please keep your support system in place. Keep your employers or, your co-workers in the loop, so that the days you don't feel well, you can reach out and, take a day off or take few days off, have lesser work, try to do it some other time, compensate. So it really differs. Like there are some professions which are very, very demanding, and people tell me that, we can't do it because we're on the floor somewhere, we're, behind with children, I can't stand the whole day. So it is a personal decision. But predominantly women continue to do their normal work. They might take 2-3 days off during a cycle, but they go back to doing their normal routine activities.
So, doctor, let's also quickly tell the listener about the cosmetic side effects of chemotherapy that we were discussing. In today's advanced treatment, also, does it always lead to hair loss? And are there any other methods that can prevent it?
So, certain drugs that are used for breast cancer do cause hair loss. Okay, not all of the drugs, but certain of the drugs which have a good way of bringing the cancer down still causes that. We can try to keep that maybe to a lesser effect by using something called as a cooling cap, which can be worn during chemotherapy to prevent hair loss. But that again is not 100% effective. Okay, but so hair loss is there, but it's a temporary phenomena. So the day you finish your chemotherapy, 1 month later, hair will start to grow back, and you will come back to your normal. You'll get your normal hair back again.
So, doctor, we're talking about the cosmetic side effects of it, and you're trying to give hope to every patient out there that these side effects are only temporary. The biggest fear is the removal of breasts. When is that recommended, and how does that affect the life of a patient?
So we can easily save the breast. Okay, so we won't run a campaign saying save the breast. So when tumors are small compared to breast size, when they're picked up early, we can easily save the breast, give them a cosmetically pleasing, normal looking, maybe even better looking breast. Okay, because we use a lot of plastic surgery techniques when we remove breast cancer to save and preserve the breast. Okay. Having said that, a small number of women may require mastectomy. That means complete removal. When tumors are very big, that means advanced stage. Or there's involvement of skin on the breast, again, advanced stage. Sometimes multiple tumors in the breast, again, which warrant a mastectomy or complete removal. But for those individuals, we offer them immediate breast reconstruction. So at the time of surgery, which is being done for removal of the tumor, we can do immediate breast reconstruction and give them, they wake up with the breast there.
Okay.
That can be done and routinely done and offered to patients. Okay. So breast cancer doesn't mean mastectomy. And sometimes people think, breast is a very redundant organ. You've done with your breastfeeding. So why keep it? Remove it. It doesn't work that way.
Only a woman can understand that.
Only a woman can understand that. And I've seen even sometimes women, old women in their 70s, 80s who tell me, no, I want to preserve my breast. I don't want to have this in my fag end of my life, where I have lost one breast, the way I dress has to change. My confidence is going to go down. And I think we have to listen to them. And that's possible. But it's just this myth around that people have that, if you remove the whole breast, it's more curable compared to, say, even you save it, which we try to bust, and most understand that and go with our advice.
I think, doctor, in the most emphatic terms, you should tell everyone out here that not every lump detection leads to mastectomy.
First of all, not every lump is a cancer, but every lump has to be evaluated and cancer has to be ruled out. So having had breast cancer doesn't mean you have to remove the whole breast. Your doctor will advise when it's warranted. You can easily save the breast and have good long-term prognosis. They do well in the long term. Is the same as removing the breast. Your doctor will just explain more in detail.
Right. And let's talk about that long-term aspect now for a cancer survivor. We've seen some very high-profile cases where the cancer has relapsed after 7 years, 10 years. That is another big fear. For anyone undergoing the treatment knows that it's been a very difficult phase of their life. To think of it coming back in your life after a certain gap, that, sends shivers down the spine. Relapse, how often does it happen in your experience, and how can you rule it out if it's possible?
So with a cancer diagnosis, no doctor is going to tell you that, I give you 100% guarantee that this is cured, okay, for a breast cancer. Or maybe a stage 0 breast cancer, I can say, yes, your chances of cure or this not coming back is less than 1%, okay. Stage 1, 97% chances is not going to come back. And like I said, stage 2, 90, stage 3, 80 to 85, and stage 4, 25. So a cancer can relapse. Having said that, the question I often ask my patients, they come and ask me, doctor, I've completed treatment. What do I worry about? Should I worry? So my answer to that is, no one can predict the future. I don't know whether I'm going to go back home today. Does somebody with hypertension keep worrying that, am I going to have a heart attack? Am I going to get a stroke? Why is that stigma that is attached to cancer so much that people worry about relapse?
So true.
If it has to happen, it will happen. We've done everything in our control, or possibly what could be done, we have done. Meaning to say, you've got it checked at the right time, you've got the correct treatment, you've taken the complete treatment as advised to you.
Right.
After that, what you could do is be happy, stress-free, exercise, eat well. That's in your hands. And those are known to help prevent relapse. Exercise, eating healthy, eating clean can help prevent relapse. After that, it's really not in your hands. Let's not worry about it. Let's live one day at a time and live happy.
That's a fabulous advice. Again, talking about the normalcy that one aspires to have even during the treatment or after that, especially, if there are any young married women listening to this, they are very, very worried about the physical and the emotional toll this is going to cause in their relationship. What about the intimacy issues in terms of their post-treatment life? Anything that affects it?
Absolutely not, actually. It's just that I think when you're going through treatment, a lot of women do tell me that they don't have the drive, or they don't feel up to it because they're feeling nauseous or tired, or things like that. But there is absolutely no contraindication that you cannot be intimate with your partner. There is nothing stopping you. It's just the individual's decision. That's it.
And that constant feeling of being tired, that's also temporary, perhaps
Yes.
some time that will also pass.
Yes, it is not that you're going to be tired the entire 6 months or 7 months. There might be few days in the month when you're not up to it or don't feel like it. But I think it's also the cosmetic side effects which play on the women's psyche, and they don't feel comfortable maybe. It's just purely nothing else. There's just no other taboo attached that you can't be intimate. It's not that you're going to transfer your cancer to your partner. We do get asked questions like that, but that's completely okay.
But that's where the role of a supportive partner comes into play?
Yes, I think a supportive partner plays a huge role. When you have somebody supportive, it really helps you get through the journey better.
Doctor, at this point in time, let's also talk about another myth. I don't know whether it's myth or not, but another factor which is getting associated with developing the risk of breast cancer is the use of birth control pills. Are these two things related? What is your advice to young girls?
So there have been a lot of studies about birth control pills and breast cancer, and there is no conclusive data to tell us that, having OCPs increases the risk for breast cancer. So I would say it's safe to use OCPs. Actually, OCPs are known to reduce risk for ovarian cancer. But with breast cancer, the data is very vague. There's no pro or against, and I would say it's safe to use OCPs.
Okay. So from a specialist point of view, for all the listeners right now who are watching this podcast, if every woman listening to this podcast should do today itself, what would your advice be? What should they do?
I would say look at your mother, talk to your mother, talk to your aunt, talk to your grandmother, or it could be your sister. Ask them have they examined themselves. Okay, because breast cancer is very, very silent. These lumps do not pain, because of which it's not picked up. So a gentle reminder that, feel yourself, examine yourself, know your body, get yourself checked, because this is something that can be cured if detected early. Let's not waste time once you've noticed something is there, saying, it's going to go away, by not facing up to it. The day you face up to good health is when you're going to live better, I think.
What a fantastic advice, Doctor. On that note, let's do a quick fire myth busting round. I'm going to just put some questions to you. You have to answer in true or false. So the first question is, if it doesn't hurt, it can't be cancer.
False.
Only women above 50 need to worry about breast cancer.
False.
If I exercise and eat clean, I will never get breast cancer.
False.
Biopsy or mammograms can spread cancer.
No.
Men can't get breast cancer.
Again, false.
Now, please explain that point.
So, men have breast tissue too, okay, though it's small in size. So 1% of men can develop breast cancers. Usually it's the elderly. Maybe increased alcohol intake, okay, can increase risk for breast cancers. There's a small percentage of breast cancers which are hereditary in men. So the BRCA2 gene, when it's mutated, increases risk for breast cancer in men. Again, a very small percentage. So especially if you have a male with breast cancer, we always say, rule out. Could this be hereditary? Could this be genetic? But yes, males do get breast cancer. The treatment is same. The stages are the same. It's treated the same way, and the prognosis or the long-term outcomes remain the same as in women.
Dr. Poovamma, it was such a pleasure to have you sit with me and explain all these aspects of breast cancer, the treatment and the myths around it. Thank you so much for answering everything with, such clarity and compassion.
Thank you. My pleasure.
And let's now talk about every woman who's listening to this podcast. Please listen to your body. Your body speaks. The doctor has emphasized on this point plenty of times. Please do pay attention to this. Check yourself, talk about this openly. Don't feel shy or awkward about these issues, because the more you seek answers about questions about your own body, the more likely it is that you will get the answers and get them at the right time. Thank you so much for tuning in, and we will see you next time with another episode.